Birth plan. We don't talk about birth plans enough, but you should start to think about your birth plan from the beginning. And what is a birth plan? So the first thing you're thinking about is who your provider is and where you're going to deliver. So you're looking at hospital. I'm not going to talk about home births because I can't, but then hospital or health facility where you're intending to have your delivery. Go and visit, see the place, make a decision. Second thing is finances. So you need to prepare as much as possible, find out what your insurance covers, and then find out if you need to top up, how are we going to do that?
Okay.
And then the next thing is, how am I getting to hospital? So towards the end, you need to have a plan of action. If my partner is with me, can we get there together? If I'm by myself, who's taking me to the hospital? If it's peak traffic time, do we need to get an ambulance? You need to think about all of these things so that you're not caught unawares.
Yeah.
And then have a conversation with your provider about any danger signs, the things we talk about that need urgent care throughout the pregnancy, so that you know this is something I can manage versus this is something I need to go in and have sorted.
Yeah.
Then also now what to bring to the hospital, that will vary depending on the facility, because a lot of them, especially private ones, will provide a lot of things for you and the baby. So just find out what you need to have in your bag. Stop coming in with suitcases. It's not a trip, guys. We don't have the space.
Yeah. It's TikTok again. Like,
Yeah,
what? Pack my hospital bag with me, and it's just like
It's like a whole
30,000 things.
I'm like, no.
Yeah.
No, a little bag or the little carry-on size suitcase, that's more than enough, because it'll be more what you leave the hospital with, which can actually be brought in towards the end for most hospitals. Then in the general public, where you have access to public or mission hospital healthcare, follow the protocol, because we do have a protocol in place. Some places it's 4 visits for the pregnancy, some places it's 6, and that's just because of limited resources.
Okay.
Make sure not to miss your appointments. Make sure to maximize each appointment and ask all your questions, and then prepare as best as you can for that facility. So again, go visit. It's within your right to go in and ask to see what labor would looks like, where will we be housed in maternity afterwards. It's your right, and most hospitals will actually send someone around with you to show you the facility. So don't be shy about it. It's better to be prepared, even physically, to know where I'm going, to also know where labor ward is. I have patients who get lost in the hospital just because once labor kicks in, everybody forgets everything we talked about before. So the more prepared you are beforehand, the better.
Okay.
And that's just a few things to think about when it comes to the birth plan.